Hi, my name is Maya Green. I'm a family medicine doctor.
Hi, my name is Kenyetta Sims, and I am a clinical research consultant, specifically working in clinical trials.
So, HIV disproportionately impacts patients of color in a variety of ways. The ways can be categorized as social determinants of health. For example, African Americans are about 42% of new diagnoses and 43% of AIDS related deaths in a time where nobody needs to die of HIV. What's the problem? Lack of equity in social determinants of health, lack of equity in education, resources, and other things that help our community grow. So if you're out there and you're a provider, the things we can do is prepare. If lack of equity is a problem, we can prepare by finding ways to infuse equity at every level of a patient's journey throughout their journey and support them throughout their lifetime.
The most common barriers for people to participate in clinical trials that are living with HIV are access to the trials. When we think about access on all levels, so access to the provider, the clinic, the hospital that may be offering the research, but also this also takes us directly back to social determinants of health. Sometimes they have difficulty with transportation. Sometimes there's difficulty around times that the services are offered or that they can participate in clinical trials. So they may have to work Monday through Friday, 8 to 5. And if that's the only time it's available, then they can't participate in the research.
One of the most common challenges that my patients have expressed to me is what we call mistrust in this field. But that gives me the opportunity to own that and say, no, there was a lack of trustworthiness of the medical industry, of the research industry towards minoritized communities.
I think that providers can help patients participate in clinical trials more by making themselves aware of what clinical trials are happening, where they could potentially refer patients, and also if they can particularly participate in clinical trials that could potentially help their patient population.
The other thing I like to talk to them about, which you taught me actually, was making the person always aware of the risks, the benefits, the alternatives, the need to sign a consent, so that means they can't do the research on me or I don't have to participate without a written consent. And on the back end of that, you also taught me helping people know at any point, if this research is uncomfortable for me as a patient, I can withdraw at any point, So thanks for that, Kenyetta.
You're welcome. Absolutely. I think that it's important for people to understand that it is participation. It is not a requirement. It is there for you to learn and to further what you can know about your HIV, and also that you can withdraw at any time and there will be no punishment. You can still see your provider and you can still continue to get help.